You may think that sudden dizziness, a brief moment of slurred speech, or weakness in one arm is just fatigue, stress, or part of getting older. But the truth is, these short-lived episodes could be silent warnings of something far more serious. A transient ischemic attack, also known as a mini-stroke. Unlike a full stroke, the symptoms of a thanks in advance may fade within minutes or hours, leading many seniors to dismiss them. Yet every thanks in advance is a red flag. A clear message from your brain that a major stroke may be imminent. I have seen countless patients who ignored these small signs, only to suffer a devastating stroke days or weeks later. That is why today I am speaking to you with urgency. In this video, I will reveal what a thanks in advance really is, the symptoms you must never ignore, the underlying causes, how doctors diagnose it, the treatments available, and most importantly, the steps you can take to prevent a full-blown stroke. These truths could save your life or the life of someone you love. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Now let us begin with the basics. What a transient ischemic attack really is and why it matters. Part 1. What is a transient ischemic attack? A transient ischemic attack, or thanks in advance, it happens when the blood supply to part of the brain is briefly interrupted, like a stroke. This blockage deprives brain cells of oxygen and nutrients. But in the case of a thanks in advance, the interruption is temporary. The symptoms may only last a few minutes or up to a few hours, and then disappear completely. That is why many people call it a mini stroke. But do not be fooled by the word mini. The damage of a thanks in advance may not be permanent, but it is a loud warning siren. Every thanks in advance means that your brain is at risk and your arteries are vulnerable. According to research, about 1 in 3 people who experience a thanks in advance will go on to have a full stroke, often within the first year, and many within just a few days. For seniors, this is particularly alarming because age already increases vulnerability. A thanks in advance should never be dismissed as harmless or ignored simply because the symptoms go away. Think of it as a fire alarm. The flames may not be visible yet, but the smoke is real, and action is urgent. Part 2. Recognizing the symptoms. The signs of a thanks in advance are the same as those of a stroke, and they often come on suddenly. The easiest way to remember them is the word fast. Face, arms, speech, time. If the face droops on one side, if one arm cannot be lifted and kept in place, if speech becomes slurred or hard to understand, then it is time to act immediately. Call emergency services without delay. But there are other symptoms too. Some seniors experience sudden vision loss, blurred or double vision. Others may have complete paralysis on one side of the body, vertigo, dizziness, nausea, or difficulty with balance and coordination can also appear. Confusion, difficulty understanding language, or trouble swallowing may signal a thanks in advance as well. The key is that these symptoms appear suddenly and without warning. Even if they last only a short while, you must treat them as a medical emergency. Waiting to see if things improve is the most dangerous mistake you can make. Part 3. Causes of a thanks in advance. A transient ischemic attack is usually caused by a temporary blockage in a blood vessel supplying the brain. This blockage can be due to a small blood clot or a fragment of fatty deposit breaking free from an artery and lodging in a smaller vessel. Many of the same risk factors that cause strokes also cause TIAs: high blood pressure, smoking, diabetes, high cholesterol, and heart disease are among the most common. Irregular heart rhythms such as atrial fibrillation can also send clots to the brain. Seniors who are overweight, inactive, or heavy drinkers face higher risks as well. Even if the blockage clears quickly, the fact that it occurred at all is a signal that the circulatory system is under strain. Without intervention, the same conditions can cause a permanent stroke. Part 4. Diagnosis and medical evaluation. If you suspect a TIA, immediate medical evaluation is essential. Even if symptoms vanish while waiting for an ambulance, you should still go to the hospital for assessment. Doctors will perform brain scans, often a CT or MRI, to rule out a full stroke. They may also use ultrasound to check for narrowed or blocked arteries in the neck. Blood tests and heart monitoring are common to identify underlying risks. Guidelines recommend that anyone who has had a thanks in advance be assessed by a specialist within 24 hours of their symptoms. If you think you may have had a thanks in advance in the past but never sought treatment, you must still see your doctor urgently. Each episode is a chance to identify risks and act before something more serious happens. Part 5. Treatment after a thanks in advance. Treatment focuses on lowering the chances of a full stroke. Depending on the cause, doctors may prescribe antiplatelet medicines such as aspirin to make clots less likely. Some patients need anticoagulants like warfarin or newer options such as apixaban, especially if atrial fibrillation is present. If blocked or narrowed arteries are detected, procedures to open or clear them may be recommended. Lifestyle changes are equally important. Lowering blood pressure, reducing cholesterol, quitting smoking, controlling diabetes, and exercising regularly all reduce risk. Even something as simple as a brisk daily walk, a diet rich in fruits and vegetables, and avoiding excessive alcohol can make a huge difference. The goal is not only to treat the immediate episode but to prevent the next one, which could be far more damaging. Part 6. Prevention strategies. Preventing a thanks in advance or a stroke means addressing the root causes. Regular checkups to monitor blood pressure, cholesterol, and blood sugar are vital. Medication should be taken exactly as prescribed. A heart-healthy diet like the Mediterranean diet, which emphasizes vegetables, nuts, olive oil, and whole grains, can protect your arteries. Exercise does not need to be intense. Moderate activity most days of the week is enough to strengthen circulation. Avoiding smoking and limiting alcohol are powerful protective steps. Managing sleep apnea with proper treatment also reduces stroke risk. Prevention is not about perfection. It is about consistent daily choices that support brain and heart health. Part 7. Why seniors must act quickly. For seniors, ignoring the signs of a thanks in advance is one of the gravest mistakes. The short-lived nature of the symptoms can make it tempting to brush them aside. But doing so can cost your independence or even your life. Remember that a thanks in advance is a rehearsal for a full stroke. Every second of delay increases the risk of irreversible damage. Families and caregivers must also be vigilant. If you care for someone with high blood pressure, diabetes, or heart disease, learn the signs and act without hesitation. Your awareness could save a life. Doctor's final words. A transient ischemic attack is not a harmless episode. It is a critical warning from your body that a full stroke may be near. Do not ignore the signs. Even if they fade away, recognize them, act fast, and get medical help immediately. Remember the word fast. Face, arms, speech, time. This simple tool can save lives. Prevention through healthy habits, regular checkups, and proper treatment is your best defense. Your brain carries your memories, your independence, and your identity. Protect it with the urgency it deserves. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward embracing these truths. If you enjoyed this video, comment 1. If not, comment 0. Do not forget to like, share, and subscribe for more content like this. Thank you for watching, and here is to living life on your own terms.